Today we're going to talk about joint replacement surgery and ImmunAde. And you're going to say, what are you talking about? How can ImmunAde have anything to do with joint replacement surgery? Well, maybe it does. And I can only tell you from my own personal experience, I didn't get my right shoulder replaced because I was taking ImmunAde. I certainly wasn't taking it for that reason. I started taking it every day back about 6 or 7 years ago because I was concerned about people taking ImmunAde every day, because originally it was intended just as a treatment for relief for digestive issues. Anyway, after taking it for about 3 or 4 weeks, I found that the pain that I'd had in both my knees and my shoulders had disappeared completely. And I was going in at that time, I'd had an MRI on my right shoulder and it was showing severe osteoarthritis. I don't know how they read an MRI that shows that, but apparently it did. They called me, as a matter of fact, right away saying you've got that. So anyway, I go in to see the doctor, and my range of motion when I saw it was gone from that to whatever I wanted. In other words, all the pain that I'd had in my joints, primarily my shoulder, because that's what I'd had, MRI'd, and my knees as well, were gone. And so, obviously, no problem with having to even think about joint replacement surgery for me. Now, I was out the other night with a bunch of friends, ran into a buddy who I usually play hockey with, but I hadn't seen him for a while. And I said, so why aren't you playing hockey? And he said, well, I've got surgery scheduled for 2 months from now on my hip, because they're telling me I've got bone on bone, I got to get my hip replaced, and then I'll maybe be able to come out and play hockey again. Maybe, maybe not. That's the only problem with having any kind of replacement surgeries. You can still function well, but can you function well enough to continue playing hockey, for example? And the reason you get the pain in your joints to begin with is inflammation. And they always tell you when you go to see the doctor, he says, well, you've got bone on bone. The only solution is replacing that joint. And guess what? No offense to the doctor, but that's how they get paid. And so, they would like to obviously take the pain away. And by the way, the surgery works well. In most cases, when somebody finishes with the joint surgery, their joint pain is gone. Mind you, a lot of their mobility and capabilities have also disappeared because, going back to hockey after knee surgery probably isn't going to be that easy. Anyway, in this guy's case, he said, I've got 2 months before I go. And I said, well, here's a good choice, challenge for you. Try ImmunAde for that 2 month period. See, and you take it every day. That's one of the things you have to do, because how it's working, it's a microbiome therapy that is reducing the inflammation in your gut. And how it does that, it helps your immune system better take care of what they call the microbiome dysbiosis, which is when you have an imbalance of bad bugs and good bugs in your gut. So now you want to fix that, and once you do that, you've now fixed the inflammation in your gut, which, by the way, at least in my case and a whole bunch of other people we've seen, takes away the inflammation in your joints. Without that inflammation, you now don't have the pain. So bone on bone or otherwise, I don't know if it's true you have bone on bone, but if you don't have the pain, why would you have the surgery? So, in my case, I eliminated the problem. Go to ImmunAde.com and look at some of the testimonials. There's a girl by the name of Susan. No, not going to give you her last name, but she had a hip problem, and she was very limited in her mobility. She used to play basketball when she was younger, and that's why she thinks she has the hip problem. She had the hip problem, as a matter of fact. Started taking the ImmunAde on a regular basis as per instructions, and within 3 to 4 weeks, she realized, as a matter of fact, she gave us a little quote saying, I had a tear roll down my cheek when I realized I had my life back. In other words, she now had the mobility to go out and exercise again. As a matter of fact, since then, she's lost a bunch of weight as a result. And so, if you've got time, if you've got pain in a joint, and you're thinking, okay, well, my only solution probably is going to be, replacement surgery, take a little bit of time and make a little investment, a couple of $100 to save you the aggravation of the actual surgery itself. And if it doesn't, so what? A cheap investment to find out whether or not you can avoid having the surgery. And by the way, joint replacement surgery is not always a bed of roses. First of all, it's painful doing the surgery. The recovery is painful. And, again, in most cases it works. You get rid of the pain. You don't usually come back with 100% mobility that you had before, but ImmunAde is a nice alternative, at least to try. Check us out, ImmunAde.com.